So, what exactly is grief? And are you doing it right or are you doing it wrong? So, I'm Dr. Virginia. I'm a board certified psychiatrist as well as a lifestyle medicine physician. And I asked that question, obviously, on purpose and a little bit provocatively, because when we think about grief, grief is usually the result of a loss. And it can be anything from a very fleeting moment all the way up to year or years. And I don't think there's any one right way to do it. Just as many people as there are on the earth, just as many cultures as there are, people grieve differently. Some people grieve very internally, some people grieve externally. But what happens when grief is a problem? So when grief doesn't go away, when you've been grieving a person or grieving something about that person for a long period of time, what can it be? Well, we're going to talk about things from the the most, I don't want to say simplest, but um, the area that has the least concern all the way up to the area that has the most concern. So the least concern would be something like uncomplicated or persistent bereavement disorder. So that's basically, it may sound really uncomfortable because it's persistent grief, but guess what? It's just grief. It's only grief that you're dealing with. And that is something that we can treat in a variety of ways, often without a medication. If we're only dealing with grief, there's no complicating factor on top of the grief, then grief apps. There's some wonderful grief apps out there that you can utilize. Grief therapy. There are a variety of wonderfully good grief therapies that can be utilized, as well as grief groups, right? I've been to churches where they have grief support groups, spiritual related or faith based grief support groups. So there are a variety of opportunities and a lot of self help programs out there if it's only persistent, unresolved grief, right? So, grief, bereavement that has not been resolved over time with all of the typical things that you would think of, okay? And so, let's talk about some complications. Some complications, or where a person might have persistent bereavement, could be a person that was not physically present or near or around the person when the typical grief processes started. So here in the United States, very common for um, uh, people, family, friends, coworkers to be notified when a person has died, and then have a ceremony, right, where people get together. Maybe it's a wake, maybe it's a viewing of the body, maybe then there's a funeral, maybe a memorial service, and then people will have a repast. They get together and they start the process of remembering the good things about the person. They go from mourning the death to celebrating the life to moving on and continually celebrating and remembering the legacy of that person. Okay, so that's one thing that very typical here in the United States. What becomes a little bit more complicated? Well, let's say the person that is deceased is in another country and you can't get there to grieve with everyone else. Let's say one of the people that's mourning is incarcerated, or in the military, right? They don't have easy access to leave where they are to go and mourn with everyone else. And so this is where a persistent bereavement can happen because they don't have the access and the ability, the capacity, for whatever reason, environmental constraints, for example, or in the military, your job or career constraints don't allow you to grieve when everyone else is grieving. And so then there's almost a delayed grief process. Another thing might be from like a chronic illness or a different type of grief, an unresolved or ambiguous grief. That's another type of grief. You're grieving the loss of a marriage. You're grieving the loss of a spouse who, or the loss of a parent who is physically there, but mentally they're not. There's cognitive disability or cognitive delays. That's another reason for persistent grief. But all of these different types of grief, we have a lot of data and a lot of research to show that all of the different things that I just mentioned, apps, support groups, individual grief therapy, those things actually work to help a person if they're only dealing with persistent grief. Now, what happens if you've got the app, you've got the books, you're in grief therapy, you're in support groups, you're doing all the things, you're in your church's, grief care group or grief share group, you're doing all the things, and the grief is still there. Guess what? You might be grieving additional things that aren't being covered with those resources. And I'm going to share 3 areas that may not be covered, but are all very treatable. Depression, PTSD, or because something related to trauma, right? And chronic pain. And believe it or not, every single one of those things that I just mentioned are very, very treatable. Medications, absolutely treatable. Interventional therapies for depression, Spravato can be used. It's a medication, but it's an in-office type medication. If you don't want to use medications, TMS. TMS can treat all 3 of those conditions: depression, PTSD, and chronic pain. I see those very commonly co-occurring with grief. And that's why I said it's not just simple grief. We've now layered on top of the grief. We've now layered the fact that you're grieving the loss of childhood because you were misused as a child or abused, abnormally used as a child. And now there's overlapping trauma, and you're dealing with the grief and the trauma. And that may have become PTSD. Well, now we're needing to treat the grief and the trauma with the trauma through medications or separate therapy or an interventional treatment like TMS. What about grief? And then the grief has evolved into depression. My number one used to be. Now it's like maybe my number 3. But when I first started out at Unity Healthcare in DC, it was my number one reason for referrals. Is this grief or depression? Right? PCP has all kinds of other things to deal with, and it's maybe outside of their scope to determine, okay, is this grief or is this depression? Let me send them to psychiatry. That was the number one referral that I got. This person's had significant loss in their family. They've been incredibly tearful, have all the symptoms of depression. This has been going on for about 6 months. I'm not quite sure, is this grief or depression? Well, oftentimes when I would see them, it was simple grief. And again, I don't want to minimize the grief process, but by simple, again, I just mean there's not something else layering on top of it. But quite often, maybe 30% of the time in my practice, I would see and grief and depression, right? Grief and PTSD because of the environment or the different things that would happen to the patient over time. The third one, the chronic pain. I see that a lot because the person is now grieving who they were, grieving what they used to be able to do, grieving what they're no longer able to do, right? They got married, they were healthy and whole, and then illness struck, and they're dealing with, significant fibromyalgia, or they're dealing with Krebs, and now they can't do any of the things that they used to do. So they're dealing with the chronic pain and the limitations, but they're also dealing with the grief and loss of the expectations, of what they wanted in the marriage. These are real things. So I want you to think about this. And if you find that you're dealing with grief and you think there's an and, grief and, right? Not just simple grief, but a complicated, persistent grief. I want you to reach out to someone. Of course, you're welcome to reach out to us. And if you're in a state that we're licensed in, we certainly can support you. But if you reach out to us and we're not, then we can refer you to, we can share information, we can share resources that will help you navigate the process. Okay. No one has to float the boat alone, right? You load the boat. That's what I learned in residency. Load the boat. You've got more people to help you get from one place to the next if you load the boat. Okay. Just reach out to us at TMS with ledlife.com, because the 3 conditions that I mentioned are all relevant to TMS. So that's the easiest place to go there. But if you go to the request consultation button, that will give you an option. Depending on where you are, it'll give you an option to go ahead and make a calendar appointment with one of our screening providers. But if it doesn't allow you to do that, then just know that it's going to a behind the scenes person that's going to be able to give you a call to try to ask you some questions that maybe the computer algorithm didn't sort out, because it is looking at your geography. And if you're in one of the states that we're licensed in, yes, I could go through the states, but we're after 10 minutes. We're going to skip that right now. Go to the website, and then you can go and find out more information, or go to one of our other sites and you can find out the different states that we're licensed in. Okay. I hope this has been really helpful for you, and I hope that you grieve well. I'm Dr. Regina. You have a very blessed day on purpose. Take care.